the difference between a facelift and a mini facelift is really the incisions that are made and the extent of lifting of the tissues that can be done. So with a mini facelift, the incision tends to only be in the anterior part of the face, in front of the ear, down to the earlobe. And a lot of the work is done through there. Whereas with a traditional facelift, the incision goes much higher. It comes from about here, all the way around, and around the back as well. So that allows for much more lifting, but also much more swelling, bruising, much more downtime. So some people are opting for the mini versus the traditional facelift. But Chantal, I feel it would be unfair not to mention a deep plane facelift if we're talking about facelifts. And this is really the one that seems to be becoming more and more popular. It's done inside the mouth, it's done through the inside the mouth, and the tissues are all lifted from inside. And what this means is that there's no external scar at all, there's no pulling on the tissues. And also, if you want to add some fat back to the cheeks, you do that all from inside as well. So this is a deep plane facelift. It probably is the most extensive of the three, but is increasingly becoming popular, as is the mini facelift for people who have problems only in this lower half of the face. Okay, well, so yes, a full assessment is definitely necessary. And what we do is we look at the different parts of your face and how your face is aged. So if you look at your face, you've got your forehead, that's one subunit, your eye area is another subunit, your cheeks area, and then your lower lip and jowl area. And we look at how to rejuvenate all four of those areas. So with the traditional facelift, the right titidectomy, what that would involve is a small incision, and then you would go inside and lift. There's a tough fibrous layer inside that the muscles attach to instead of bone. And this is what allows us to have so much movement in our facial muscles. It's called a SMAS layer. So what we would do is lift the SMAS layer inside, and then the skin is just redraped gently. In some cases, you find that the surgeon is maybe not skilled at lifting the SMAS layer and then relies on the skin to do the facelift. And that's when you get this windswept appearance that you see sometimes in the older people. Another emerging trend, Chantal, is to start doing facial rejuvenation at a younger age. And this would allow you to avoid having a drastic change. If you look at people like Jane Fonda, for example, I don't know how true it is, but the story goes that Jane Fonda had a facelift every 5 years from the age of 40. And thus, no one ever actually saw her aging. I don't know if Tom Cruise did the same thing or not. Yes, definitely. So during our assessment, we would assess from an objective point of view where the greater signs of aging are, but we'd also have to assess what impacts you the most. So I might look and think, your eyelids need the most work, but you're worried about your jowl area or the area around your mouth. So I have to address both to give you a complete result. So we would address assess and address whether you would need a mini facelift, a full facelift, a deep plane facelift, or sometimes, Chantal, in very rare cases, you could get away with just fat grafting and an upper eyelid bleph and achieve a great facial rejuvenation aesthetic. So we assess and tailor it for each individual. So a facelift is generally a very safe procedure in terms of the procedure itself. The part that could make a facelift a little bit more dangerous is the fact that most people who want it come in their late 50s, 60s, or even 70s. So it's their comorbid health condition that could then present a possible risk, especially of deep vein thrombosis and a pulmonary embolus, which is a clot in the lungs. So to get around this, what we do a lot more is we don't do a facelift under total general anesthesia. We do it under some sedation and a lot of local anesthetic in the face. This is still done in theater, But because the patient is not totally asleep, their clotting system is not activated, and we avoid the deep vein thrombosis and pulmonary embolus. Other than that, locally in the face, the biggest risk would be if the surgeon accidentally cuts one of the nerves that supplies the muscles that move the face. So the nerve that would most commonly be affected is in the upper area here. So if this nerve is cut, you will not be able to move your forehead. Sometimes the nerve that gives you a smile, the zygomaticus nerve, can accidentally be cut, in which case that would be a debilitating problem, because smiling and facial movement is such an important social parameter. So not being able to smile would be a major complication. For patients with a history of migraine and hay fever, a facelift is still a very safe procedure. It should not affect either of those parameters at all. What is interesting to me from your question, Chantal, is that did you know that you can actually have surgery to improve your migraines? Most people will tell you that their migraine starts in a very specific spot. And if I show you on your face, it's either often here, up here, or at the back here. And those are areas where there's often a nerve exiting through a hole in the skull. And the tension around there causes the migraine. So what we do is we do a little bit of Botox in the area. And if the Botox improves the migraines, we know that a permanent surgical release of that nerve can cure your migraines. So that's just an interesting side factor. But to answer your question, facelift and migraines, no danger at all.